Hello everyone, welcome back to the channel. In today's lesson, we are going to study the anatomy of the stomach in a simple and easy to understand way. Whether you are a nursing student, medical student, anatomy student, or simply interested in learning human anatomy, this video will help you understand the stomach, including its location, parts, cells, blood supply, innervations, lymphatic drainage, and important clinical correlates. Let's get started. The stomach is a hollow muscular organ of the gastrointestinal tract located between the esophagus and the duodenum. Its major functions include storing food, mixing food with gastric secretions, beginning the digestion of proteins, and controlling the gradual release of the food into the small intestine. Think of the stomach as a muscular mixing chamber. After food passes through the esophagus, it enters the stomach where the muscular contraction mixes it with the gastric juice and concentrates it into a semi-fluid substance called chyme. The stomach is a J-shaped organ when moderately distended. Its size varies depending on how much it contains, but in adults it is approximately 25 cm. The stomach is located in the upper left part of the abdomen beneath the diaphragm. Most of it lies in the epigastric and hypochondriac regions. It is surrounded by several important organs. Superiorly, it is related to the diaphragm. Laterally, it is related to the spleen. Inferiorly, it is related to the structure such as the transverse colon. Posteriorly, the stomach is related to the structures forming what is commonly called stomach bed. The stomach can be divided into four major anatomical regions: the cardia, the fundus, body, and the pyloric part. The cardia is the region where the esophagus enters the stomach. The opening between the esophagus and the stomach is called the cardiac orifice. The fundus is the rounded upper part of the stomach, located above the level of the gastroesophageal junction. It commonly contains a small amount of swallowed air, which can appear as a gastric air bubble on imaging. The body is the largest central portion of the stomach. It makes up of most of the stomach and is an important region for both mixing and secretion. The pyloric part is the lower portion of the stomach. It consists mainly of the pyloric antrum and the pyloric canal. The pyloric canal ends at the pyloric sphincter, which controls the passage of gastric content into the abdomen. A simple way to remember the four regions is cardia, fundus, body, and pylorus. The stomach has two important borders called curvatures. The short concave border is the lesser curvature. The longer convex border is the greater curvature. The lesser curvature gives attachment to the lesser omentum, while the greater curvature gives attachment to the greater omentum. The stomach also has anterior and posterior surfaces. These surfaces help define its relationship with the surrounding organs. Now, let's look at the microscopic structures. The wall of the stomach has four major layers: mucosa, submucosa, muscularis externa, and serosa. The mucosa contains gastric glands and specialized cells. Several important cell types are found here. The mucous cell. The mucus produces mucus. The mucus helps protect the stomach lining from hydrochloric acid and digestive enzymes. Paretal cells produce hydrochloric acid they also produce intrinsic factor, which is necessary for absorption of vitamin B12 in the terminal ileum. The chief cells produces pepsinogen. Pepsinogen is converted into pepsin in the acidic environment of the stomach. Pepsin helps digest proteins. The G cells are mainly found in the pyloric region. They produce the hormone gastrin. Gastrin stimulates gastric acid secretion and supports gastric activities. Blood supply. The stomach has an extensive arterial blood supply because digestion requires significant secretion and muscular activities. Most of its arterial supply comes from branches of the celiac trunk. The main arteries include left gastric artery, right gastric artery, left gastro-omental artery, right gastro-omental artery, and the short gastric arteries. The left and right gastric arteries mainly supply the lesser curvature. The left and right gastro-omental arteries mainly supply the greater curvature. The short gastric arteries supply the fundus. Venous blood generally follows the arteries and eventually drains into the portal venous system. Innervations of the stomach receives both parasympathetic and sympathetic innervations. Parasympathetic innervation supply mainly from the vagus nerves. The vagus nerves increase gastric motility and secretion and help coordinate digestive activities. The sympathetic innervation fiber reach the stomach mainly through the celiac plexus. Sympathetic activity generally reduces gastrointestinal motility and secretion and causes vasoconstriction. Lymphatic drainage. Lymphatic drainage of the stomach is critically very important, especially when discussing gastric cancer. Lymph from different parts of the stomach drains toward lymph nodes associated with the major arteries supplying the stomach. These include the gastric lymph nodes, pancreatico-splenic lymph nodes, pyloric lymph nodes, and the ultimately lymph node reaches the celiac lymph nodes. This pattern is important because cancer cells from the stomach can spread through these lymphatic pathways. Clinical correlates. Let's now discuss some important conditions involving the stomach. Peptic ulcer disease. A peptic ulcer is a defect in the gastrointestinal mucosa that extends deeper than a simple superficial erosion. Common causes include Helicobacter pylori infection and the use of non-steroidal anti-inflammatory drugs. An ulcer can occur in the stomach or duodenum. A serious complication is bleeding. Gastritis. Gastritis refers to the inflammation of the stomach lining. It may be caused by factors such as H. pylori infection, non-steroidal anti-inflammatory drugs, alcohol, or other conditions. Pyloric stenosis occurs when the pyloric passage becomes abnormally narrowed. In infants, hypertrophic pyloric stenosis causes thickening of the pyloric muscles and can lead to forceful vomiting. Gastroesophageal reflux. Although gastroesophageal reflux primarily involves the junction between the esophagus and stomach, understanding the anatomy of the gastroesophageal junction helps explain why stomach contents can sometimes move backwards into the esophagus. Quick summary. Let's summarize what we have learned. The stomach is a J-shaped muscular organ located mainly in the upper left abdomen. It lies between the esophagus and duodenum. Its four major parts are cardia, fundus, body, and the pyloric part. It has two curvatures, lesser and greater curvatures. Important gastric cells include mucous cells, parenchymal cells, chief cells, and G cells. The stomach receives arterial blood mainly from branches of the celiac trunk. Its parasympathetic supply mainly comes from the vagus nerves, while parasympathetic fibers travels through the celiac trunk. Its lymph drains through the gastric, gastro-mental, pancreatico-splenic, and pyloric pathways towards the celiac lymph nodes. If this video helped you understand the stomach anatomy better, like the video, subscribe to the channel, and share it with another student who needs to learn anatomy in a simple way. Thank you for watching.